Hello. Today we will be discussing chemistry testing and the diagnosis of multiple myeloma. We'll be doing a case study, and it is as follows. A 67-year-old male went to an emergency room and his chief complaint was intense acute lower back pain. The patient denies any fall or accident. He also stated that he has been quite thirsty and drinking water does not seem to help. He states his appetite has diminished and he's been suffering from intermittent dizzy spells. The physician examines the patient. His plan will be to obtain an x-ray of the patient's spine. He is also ordering a CBC and CMP. The lab results are as follows. Seems the patient has a low white count and his hemoglobin is low. He has a high calcium and a high creatinine. The radiology x-ray shows a lytic lesion of L2 and the doctor may be leaning towards a multiple myeloma. And with this lab results in x-ray, he might use the CRAB acronym: hypercalcemia, renal dysfunction, anemia, and bone destruction. The further testing required is serum protein electrophoresis, a 24-hour urine electrophoresis, serum immunofixation, serum light chains, and LDH. Serum protein electrophoresis is the separation of substances by their migration as a charged particle in an electrical field. The proteins have different molecular weights and net charges, and at a given pH under an electrical charge, they will separate. The procedure is serum samples are applied to an agarose gel medium close to the cathode end. This medium is saturated with an alkaline buffer and a pH around 8.6. An electrical current is applied to the agarose medium and will separate the proteins based on charge. Once the exposure time is up, the paper is removed, dried, and fixed. The paper is then stained using a variety of dyes such as Kumasi Brilliant Blue and Amido Black. The transparent strip is then analyzed using a densitometer, which is a spectrophotometer that measures the light absorbance through the paper. Serum protein is separated into 5 fractions: albumin, alpha-1 globulin, alpha-2 globulin, beta-1 globulin, beta-2 globulin, and gamma globulin. On the left, you'll see an A. This is a normal protein electrophoresis, as well as C. C is the graph that the densitometer will print out. B shows a monoclonal component, and D will show you the M spike the physician is looking for. Here are the patient's results, and the pathologist has interpreted that there is an abnormal peak within the beta-1 region that is consistent with a monoclonal paraprotein. He recommends urine immunofixation and serum-free light chain analysis. With antibodies, they are made up of light chains and heavy chains. The light chains will consist of kappa and lambda, and the heavy chains consist of immunoglobulins. Serum-free light chain test will give a ratio of kappa to lambda. If the ratio is elevated, it can indicate an increase in one of the light chains and the level of disease. Serum immunofixation is really similar to serum protein electrophoresis. But after the proteins are separated by their charge, the gel is incubated with different antisera to the immunoglobulins IgG, IgA, and IgM. The pathologist interprets this test result as an IgG kappa monoclonal paraprotein or a monoclonal gammopathy. It is identified. Urine protein electrophoresis. In order to quantitate urine proteins, a 24-hour urine collection is required. The volume of the specimen is recorded in order to calculate the protein. The protein that is excreted in the urine is secondary to the glomerular tubes and are not able to absorb them. The Bence-Jones proteins are typically present with multiple myeloma. The protein can be measured by the turbidimetric method using salicylic acid, trichloroacetic acid, or benzthonium chloride. The proteins are precipitated as fine particles and the turbidity is measured spectrophotometrically. The patient's results in a high urine protein and also the beta region is high. The pathologist interprets that there is an abnormal peak within the beta region that is consistent for a monoclonal paraprotein. It looks as if the doctor has come to a conclusion. The The patient has multiple myeloma. Multiple myeloma is caused by the plasma cells that overproduce a monoclonal antibody and are kappa or lambda light chain restricted. This antibody is called monoclonal proteinemia, an M spike or monoclonal immunoglobulin. Thank you for listening.